Hi everyone, my name is Kristen, and today we'll be talking about observational studies. Let's explore three major types: case control studies, cohort studies, and cross-sectional studies. A case control study compares people who already have a condition, called the cases, with people who do not, called the controls. Researchers then look backwards or retrospectively to identify possible exposures that might be linked to the condition. The main purpose is to identify potential risk factors. It's important to note this study shows association, not causation. In terms of advantages and disadvantages of case control studies, these studies are ideal for rare diseases, they're quick and cost effective, and they're useful for hypothesis generation. For disadvantages, these studies can't estimate incidence, they're prone to selection bias, and there's limited ability to study rare exposures. A cohort study, on the other hand, follows a group of people over time to see how exposures affect outcomes. Participants are monitored over a long period of time to see who develops the outcome. This makes cohort studies powerful for understanding risk over time. Cohort studies can be prospective, looking forward into the future, or retrospective, using existing data. In terms of advantages and disadvantages, cohort studies can measure incidence and risk, they can assess multiple outcomes from the same exposure, and they're convenient for studying many diseases. For disadvantages, these studies are time-consuming and expensive, they're not efficient for rare diseases, and due to long periods of observation, there is a risk of loss to follow-up and bias. A cross-sectional study involves taking a snapshot of a population at a single time point. It measures both exposure and outcome simultaneously. There's no waiting and no follow-up. It's used to describe the prevalence of a disease or risk factor at a specific moment. Unlike other studies, cross-sectional studies are neither retrospective nor prospective. They focus on measuring prevalence and identify associations. In terms of advantages and disadvantages of cross-sectional studies, these studies are fast and inexpensive, they're useful for public health surveillance, and they can help study multiple exposures and outcomes. For disadvantages, these studies cannot determine cause and effect, they cannot measure incidence, and they're not suitable for rare diseases.